Hello everyone, today we are back at Colorado Springs Orthopaedic Group, and if you have had shoulder surgery, you may be wondering when it's time to get back to weightlifting. Matthew Kudrin is Doctor of Physical Therapy. How are you today?
I'm doing great, Claudia. How are you?
I'm great. Okay, so for people who've had shoulder surgery, when can they get back to weightlifting?
It kind of depends on the surgery. So there's a few main typical surgeries that are occurring when you have a shoulder surgery. The most common is a rotator cuff repair, which the rotator cuff is a group of 4 muscles that essentially surround the shoulder joint itself to keep the shoulder joint centered and squared. The shoulder joint itself is kind of like a golf ball sitting on a tee, so it's not very stable. The rotator cuff helps keep that centered and stable. So there might be a tear within that muscle, so that muscle might need to be repaired. Another typical surgery is a repair of the labrum within the shoulder. The labrum is a cartilage ring, so the socket part of the shoulder is a cartilage ring that surrounds it. It helps to deepen the socket, and there's 2 different places where there's commonly a tear. One of them is on the top part, which we call a slap tear, superior labrum anterior to posterior or front to back, or a Bankart repair, which is a repair of the front and bottom part or anterior inferior labrum. The top part tear, the slap, is typically occurring if you get a clicking sensation and just general pain in the shoulder. The tear of the front part of the shoulder is if you have a history of dislocations of the shoulder and you constantly pops out, pops back in. It's just a recurrent thing. So both of those help to restabilize that shoulder. Now, as you get a little bit older, you might start to develop some arthritis within the shoulder, and there might need to be a replacement of the shoulder joint itself, where they put in metal hardware to replace that ball and socket complex. If the rotator cuff is torn severely within that too, they might have to do what's called a reverse total shoulder, in which instead of a ball and socket joint, it is more of a socket on the ball, which you'll have a little bit of limited motion with it. So within those different surgeries there's different time frames of when you can start to get back to lifting weights. In very general terms, that process will begin anywhere from about 3 to 6 months after the surgery.
How does somebody know, okay, I think I'm ready to go, I can weight lift again? Like, what should they be looking out for? What needs to happen before they do that?
So with guidance from their surgeon and their physical therapist, there's 3 main things that need to occur before getting into the return to weightlifting. 1 is tissue healing. 2 is getting full range of motion back within the shoulder, being able to reach up overhead, out to the side, backwards, behind your back. And then the 3rd one is getting full strength of both the rotator cuff, those muscles that help stabilize the shoulder, but then also the muscles that help stabilize the shoulder blade. That when you move your arm, the shoulder blade moves and rotates, and actually accounts for about 1/3 of your arm's ability to reach up overhead. So once you have those things back, the tissue healing, the full range of motion, and the strength back, then you can start to look at returning to weightlifting.
Okay, what type of lifts are generally safe for someone who's undergone the surgery?
Yep, some of the exercises that are generally safe to perform are general bicep curls, tricep pull downs, and then rotator cuff exercises you get from your physical therapist that include a band where you rotate in and out with the arm through there. Now, some general exercises to avoid. The rule of thumb I tell my patient is to avoid exercises where you can't see your hands or exercises where your arms are in a further away position away from the body. So ones where you can't see your hands might include a dip exercise where your arms are behind you, pushing the body up from a bench there. A latissimus dorsi pull down where you're pulling your arms behind your head. Or also a tricep dip where your arms are up overhead, raising up in that manner. And then some other exercises to avoid are where the arms are further away from the body, where raising your arm forward with a load, going forward or sideways. We generally recommend not to do those types of exercises, or exercises where your hands are in a wide grip. So like a chest fly, a bench press where your arms are in a wide position, or a latissimus dorsi pull down where your arms are wider as opposed to closer in. All of those exercises can put the shoulder in a little bit more of a vulnerable position, but that's not to say that you can't get back to doing those. It's just more of the higher level athletes that might be doing that. But for the general weightlifter, you'll tend to want to avoid those exercises.
Well, great information. Thank you so much for taking the time to talk with us today. All right, everyone, be sure to check with your doctor before you go back to weightlifting, especially if you've had a shoulder surgery. We'll see you next time on Medical Minute.